One of the main reasons I did this course was actually when I spoke to Corey a few months before I decided, and he said one thing that really stood out to me. He said, it's not just the implants, we're going to help you become a better dentist. And I think overall that's been the most rewarding part. So not just the implant placement, but understanding of occlusion and understanding complex cases, and also understanding when you should refer and some of the cases that you can't yet tackle, and realizing the part that we can play as part of a bigger team. So overall, it's been a really, really rewarding year for me. I've really enjoyed it. I've placed implants. I didn't think that that was going to be as easy as it has been. But most of all, I know what I can do and what else I need to work on. So it's not the end of my implant journey, it's simply the beginning. But it's been a really, really good introduction into implants.
I had a bit of experience of restoring implants already. I've been restoring them for about 3 years, and I felt I was ready to take it to the next step with a surgical course. I looked around at all the different courses that were out there, and I felt that although there were a lot of great clinicians providing really quality training, the opportunity to be trained by 3 of the best dentists in the country, being Koray, Zaki and Fazila, I felt would give me the most rounded education and give me the most clinical experience I could get. So over the year I've placed 8 implants on the course under their tutelage, and they've been a full range of different surgical situations and teeth and positions. And I really feel like now I'm ready to go out into my clinic and start placing implants on my own, under a mentor obviously, and hopefully with the support of the trainers moving forward.
I would recommend all my colleagues who wants to pursue a career in implant dentistry to do this course, because the lectures are very thorough and you get a good foundation before you start with implant dentistry, and the surgical days have been amazing. Good support again, and it's just brilliant.
I don't regret coming on this course at all. It's definitely what I was looking for in an implant course, because I wanted not just a implant sort of related course, but something that was more restorative based as well. So I feel that I've got the knowledge, theoretical and practical, of assessing, treatment planning, and also providing implant care for my patients. I also know which cases are suitable for me at this stage in my career and which I can get further advice and mentor from. So I'm really grateful for that as well. I would highly recommend this course to anybody who's looking for an implant course which is comprehensive rather than just implant based, because I feel it covers all disciplines of dentistry. So good luck in finding the right course for you.
After joining the course, it has changed everything in my practice. The way I look at the patients, the way I see the various treatment options as well. And during this course, this has been very different from other courses which I have looked before. And this course has a lot of comprehensive theoretical part, and the best part of the course was the practical, which is one-to-one mentoring and on live patients, and the good support and easy access to any mentor anytime. That has been quite brilliant about the course, and it has basically changed altogether everything about the way I practice.
The best bit of the course for me, there's been a few. Certainly I wasn't expecting to get such an improvement in my knowledge of occlusion. And that was really driven home very well early on, and it's actually changed the whole way that I practice my dentistry and how I look at cases. I thought I knew what I was doing looking at cases, but now I look at them from a slightly different angle, and I think that it's helped me restoratively planning my bigger cases, as well as obviously allowing me to provide implant restorations for my patients. The amount of clinical surgery time has been amazing, because obviously you have 3 clinicians, loads of time to fit in patients, and so I've really got my hands dirty and got a lot of implants placed.